Good evening. I think we can switch up the mic and discuss amongst ourselves. Guys, we are not ghosts, at least tell us we are alive. Yeah. Good evening. Thank you. Please be a kind audience to us. I know it's been a long day. I've got a very interesting panel discussion. And when Harbinder asked me to take it, I was kind of excited because we keep discussing this on and off about ethics, money in the healthcare space. Before I start, just a couple of things that everyone must be knowing about. People would be not my age, a little younger. When I was growing up, there were three, I don't know how to call them. They're now like businesses, which were treated as institutions which became businesses. One of them was healthcare, okay. Second was media, and the third was education. One never thought of profits. By the way, I'm also one of those industries. We are in the media. That thing has changed, and even I was just thinking of where we might be diluting, our ethics in the industry. When I mean, it's a business world. Fortunately, we don't run the 9 o'clock TV programs screaming and shouting and all of that. So touch wood, I think we are fairly safe, but I'd like to see if we are crossing the line anywhere. The second piece of information that, I'm sure a lot of you know, is that 82 crore people in India, which is 55% of our population, gets free ration, and there's a commitment to give it to them for the next 5 years. Now, food is a necessity, healthcare is a necessity. So we're coming from very tight space, okay, where people can't afford food. We are talking of healthcare. I'll jump into the discussion now. I'm not the expert, would love to hear from you. Sunil, if I may start with you, okay. You all are investors in the healthcare space. How do you assess a company's a potential target, healthcare targets, investment targets, ethical practices, when you are investing? And how do you ensure that, the ethical practices and patient welfare align with, your vision, your objectives when you'll invest?
Thank you, and pleased to be part of this gathering. And just to give a context of what we do, we are a healthcare-focused private equity fund. We only invest in healthcare, and we invest across all segments of healthcare, from hospitals, diagnostic, pharma, life sciences, medical devices. And we invest in South and Southeast Asia. The reason being, we are more around, we are more focused around creating impact through our investments in healthcare, and these are the two large regions where the need for healthcare is substantially higher than the supply of healthcare. So that sort of also sets the context of how we look at opportunities. So first and foremost, we are a private capital, and therefore returns for us is important. And it's not only for us that the returns are important; it's also for sustainability of any business or any institution. It's important that the institution makes some profit so that they can grow, they can hire more people, they can basically deliver those social goods, be it healthcare or be it education. So profitability is a very, very important element. Now, how we sort of try and differentiate and try and bring the ethics element into it is that while growth is important for us, it's also important to see that it's done in a very ethical way, which serves the cause, of the society, the needs of the society. And the way we handle or tackle it is that for us, ESG is a very, very important component, which is environment, social, and governance. And quite a bit of what we talk about in ethics fits between the three of these things, which is environment. Again, a large part of ethics. We are not supposed to spoil the environment. Social, what we are doing for community, social, including employment, gender equality and stuff, and governance. If you have the right governance, the first two will. There's a high probability the first two will follow. So that is one big part that is an important thesis of our investment. The second important part of our thesis is impact. which is what is the kind of impact. And ESG and impact are two bit different things, while quite a few people try and interchange the definition. What is the impact that we are creating, both in terms of number of patients that we are servicing, in terms of employment that we are generating, and there are quite a few parameters. And at what price point are we delivering those services and goods? And it's very, very objective. We have our own proprietary matrix that we use to score the companies that we invest in at the time of our investment, to have an objective target that if I am rating this company on a scale of 5, it's a scale of 5, 2.5, then what is my objective in terms of growing the impact by the time we exit, which is take this 2.5 to say 3.5. It's set right at the time when we invest. And we report this objectively to our investors, because our investors do want to see that we are delivering healthcare through our investment in a very ethical, ESG compliant and impactful way. So I can talk about our investment strategy, that we try and deal with this concept of ethics to very objective ways of doing it.
Thank you. Before I ask you a question, I'd just like to request, whoever's speaking behind to speak a little softly or speak outside the room, because I can get the sound here. I'm sure the speaker is also getting affected. Dr. Singh, you come from a hospital which is known for, ethical healthcare. How do y'all ensure, let me put the question, do you have specific initiatives or policies implemented to ensure ethical healthcare, right from diagnosis to treatment to follow-up? How do you all manage?
So thank you so much, and it's a pleasure to be with the esteemed panelist. He has invested so much, and I feel very scared if he looks at our institution. It's a charitable. He'll start owning it up. So what we have as a process in place is something called as utilization review, and we don't want all major initiatives to be run by clinical team. So here is a nurse who has a very decent experience, who is a nurse practitioner, has a decent experience both in critical care as well as procedures. She runs this utilization review and she has a team. So they look at appropriate stay of the patients, they look at appropriate prescriptions, they look at appropriate diagnostics and appropriate procedures being done. So there's a random check of files, which and both active and discharge, where if there has been a stay which is not valid, they are empowered to question even the cardiovascular thoracic surgeons or a solid organ transplant surgeon. If the prescriptions, if there are polypharmacy which is not recommended, which is not evidence-based, they can give recommendations and question. We have done this for almost 15 years and it has worked. Initially when we started, it was very, very difficult. But then management support and empowerment is 100% defined. And we have now a team of 10 nurse practitioners who just runs a utilization review other than their other multitasking activity. So appropriateness of lab investigations are dealt with almost on a daily basis, and appropriateness of radiological investigations, because there are evidences you cannot just have a headache or a backache and then MRI can be prescribed. The recommendations from the spine or associations AO spine is that you will have to wait for 21 days and then only the MRIs are. So the evidences are all defined. It's agreed. It's an expert committee group, and that is how it is sort of taken forward. Other than that, every clinical team have to do 2 clinical audits per year. That's mandated. So they need to introspect their own work and they need to transparently present this in front of all. It's like a big team meeting where they do present that they goofed up, or there is a large sections of mismanagement, or maybe they didn't adhere to some of the guidelines, and that is perfectly fine. So those 2 segments are done. One of the other things is, other than the institutional ethics committee, which largely looks at the research, there is a bioethics committee where anybody within the team, the patient, medical social worker, nurse, clinical team, anybody can raise a request to constitute or call for a particular patient a bioethics committee. So many a times you must have heard that the patient says, हमें पता नहीं वो मर गया था फिर भी वेंटिलेटर पे था. And this creates a distrust. So here is where we talk to the patient and the team before they are put in onto a mechanical ventilation. And if it is futile, if the bioethics committee feels that it is futile, the care is futile, we do withdraw or withhold ventilation because we think it's unethical from our part because they had to, for continuing of the critical care treatment, they might have to sell property, they have to sell jewelries, they have to sell their land, they have to, and they become a pauper, and then the patient unfortunately after a couple of days or weeks expire. So we assist and facilitate them to take decisions, and we do withdraw and because and withhold ventilation. But then there is adequate communication happens with all the family members. So there are many such steps which we take internally to sort of self-regulate ourselves.
Thank you. Sunil, I'll come to you. Corporate hospitals are often criticized for, prioritizing financial gain over patients' welfare. And you see a lot of this in media. And, several of these hospitals are now listed. Okay. As an investor, what is your advice, to these corporates to have fair practices, managing the financial gains, have fair practices for patient welfare, ethical standards, all of it. What can, how can you influence them? But, what is your advice to them?
No, so from our perspective, and given those two metrics that we follow, it is very clear that we need to have a patient-centric approach. That is the number one thing. And within patient-centric approach, you have a lot of elements, be it proper care, proper diagnosis, care as per diagnosis, proper pricing. So all of it falls, as an element to the whole patient-centric approach. I think the reason why, the so-called corporate hospitals get a bad name relative to the other hospitals is because of what gets reported. And what gets reported is just tip of the iceberg. Actually, if you see larger portion of, this question around ethics comes from the non-corporate hospitals, the ones that are not reported. In fact, corporate hospitals and the ones which are the bellwethers, the larger, they follow maximum or have maximum elements that you could call as ethics. And I can give those elements. Their protocols are digitized. And I'm not saying that, it's black and white. There are grays. But probability, I'm talking about probability. As far as quality is concerned, they are much ahead compared to the so-called non-corporate hospitals. As far as the entire trail of prognosis, diagnosis, and care is concerned, they are much ahead because they digitize everything. So there is a proper trail. There are proper committees which are set up to sort of review and do it. Most may not follow the way Dr. Sanjeev mentioned. Obviously, this is an institution that most see as a benchmark. But by and large, they strive to get closer to this and are more transparent than the non-corporate hospitals. I think to establish a trail in a non-corporate hospital is going to be much more challenging. And then, it's the point around pricing. Now, the point around pricing is very controversial. The reason why it's controversial is for the first statement, because of the reason that I made the first statement, that a good a center of excellence which follows all the elements of ethics they will have no option but to provide it at a particular cost. If there is a hospital which is in central Delhi or in central Mumbai, there's a cost to real estate, there's a cost to quite a few things. The cost of manpower will be at a different level compared to any other hospital. So now if you have to bring the best quality of care, it comes at a particular price. And the question around it, the ethics mainly revolves around price, some around diagnosis and prognosis and obviously what is the prescription. But it's between these two that, the biggest question comes. So this is a conundrum that, everybody is trying to solve for. But the reality is that if a high quality hospital has to sustain commercially to be able to deliver that quality of service, it will come at a particular price. I haven't come across any hospital today, and especially the ones that are listed, which are delivering ROCs of upwards of 25-30%, which means that their returns are around 20-25%. Maximum hospitals today, and we have some of the industry leaders here, are delivering returns of 15-17%. So whatever one is investing, they are getting about 15-17%. Nobody is making a 60-70% return. Their EBITDA could be 25-30%, but EBITDA is not return. It is about what you are investing and what you are getting back. So the data is out there in the open to see what kind of returns the hospitals are making.
Yeah, so which means it's not the killer instinct on the financial part. So, Dr. Singh, often there is, there could be, and there actually is a conflict of interest when it comes to maintaining good medical practices, especially when financial incentives come in play. And I'm not a healthcare professional, but I do hear that there are incentives that doctors get, on billing. How do they maintain? How, in your opinion, should they maintain fair medical and business practices and balance them, in such a situation?
Very difficult question. I think while we are building this institution, we would have interviewed close to 5,000 doctors across the globe and across the country. Selection of these people are extremely important. And doing a background recce is very, very critical. Because that is where, when we were building this hospital, we took two major decisions. One is, we will not take star doctors. We are ready to wait and ready to just do good quality practice. Star doctors, so-called star doctors, I'm not saying whatever the star term which exists, they bring in their own ego. Unfortunately, every clinical person has their own clinical ego. But then they don't fit into the culture. So there is an isolation practice and they don't practice team. The second decision which we took is, we will not bring teams. So there is this group of people, 150 people come along with them, 300 people, and then they will go also. And we were so surprised when we were meeting a lot of good clinical teams. We realized that the institution has invested close to 50 to 70 CR on them, and they are ready to meet us to join our institution. So selection of these team is extremely critical. So it would be just not the faculty, but the staff. When we started, we started with a salary, but then ours is generally a group practice. So you don't create a competition within 12 senior cardiologists who are there in the team. Everybody contributes to the pool, and from the pool, according to the performance-based practice, there is a division. Now that is a slightly difficult, because unfortunately healthcare is hierarchical in nature. So a head of department and a professor is a professor, and he wants to take the bigger chunk for whatever reason. But then there are appraisal mechanisms. So if he has published a good quality paper, if he has got good grants, if he is bringing in patents, he does get there, but not because he's the professor and the head. So we have taken some hard decisions of bringing in 38, 39-year-old and making them head of departments, which is not liked by many, but so be it. So it's a group practice, and then there is a performance-based incentive which has been given. And for the last 25 years, we have never given targets to our clinical team. We just do good work, and we have been seeing decent results. The other portion which I just wanted to add, if I may, that patient is part of our patient advisory council. There was this gentleman who was there who was reversing his truck, and he ran over, unfortunately, on his son, and he crushed the pelvic area, the rectal, the urethral, and he was there with us for almost 110 days. And he knew in and out of the hospital, because having spent 110 days, you know in and out. He's part of our advisory council, and he advises what good, what bad practices being done. So he watches the housekeeping, he watches the nursing, he watches the clinical team. And so there are lots of these patients who are part of the team. So there is a lot of this input which comes in a very, very transparent manner. And there are few volunteers and monks, so it's not always a corporate management board kind of a meeting. It's a very ashram-based meeting, so they are allowed to throw in the ideas.
Thank you. You know, I feel compelled to share a story. This is true. I have a plumber. His name is Harilal. Roughly my age works very hard, very pleasant. I always say I trust my children with Harilal. You know, so he can come into the house. I have 2 daughters, do stuff. I've got 2 dogs. He's kind of good with them. They're good with him. So I was chatting with him maybe about 3 months ago, 6 months ago, and saying, "Kitna kaam karte rahoge?" So he said, "Sir, abhi aur kaam karna padega." So I said, "What happened?" So he says, "I spent a couple of lakhs on my son's education." So I said, "What is he doing?" So he said he wants to be a doctor. So I said, "Wah, doctor banega, aapki seva karega, then you will retire." So he said, "Nahi sir, aur chakkar hai," but he says, "I don't mind, sir." He says that my child saw a lot of people suffering and dying in the village. So he wants to become a doctor, and he says वो सेवा करना चाहता है, उसको पैसे नहीं चाहिए. So I asked him, तो फिर आपकी सेवा कौन करेगा? He says कोई नहीं, वो दुनिया की सेवा करेगा. I will work until I can. Now, you know, those are the kind of. He says he doesn't want to make money. He wants to. It's come from within to be a doctor. So crazy stuff. Sunil, I'll come to you. I have to read this question. What role should regulatory bodies and industry associations play in holding corporate hospitals accountable for ethical lapses? And how can investors collaborate with the stakeholders to promote ethical healthcare practices across the industry?
It's a difficult one, because I'm sure.
I gave him one difficult one, has to come to you.
I thought you'd already given me 2 difficult ones.
Okay. So.
No, it's very, very difficult to sort of come out with specifics. But yes, we do need regulators, and we do need all the stakeholders to participate. There are examples of other industries. There are examples of other countries. For some reason, it hasn't taken off in India. I know, we had this bill around the medical practitioners, which was then withdrawn. But I guess it's high time that we should have the right protocols. But more importantly, within the right protocols, we should have the understanding that not all the hospitals can be sort of treated in the same manner. If I take the case of total industry, it is for the balance 94-95% to follow. So do we have the infrastructure in place to implement it or not? While everybody is targeting the corporate hospital, but the issue is going to be somewhere else.
Sir, little out of time, but I have to ask you this question. Y'all are known for your ethics and professionalism. Amrita Hospital is known for that. I'm sure you also know about the rest of the industry. What is your advice? What are the learnings that other healthcare providers, hospitals can take from Amrita hospitals to ensure good, fair practices and, possibly the word profit doesn't come instinctively, profitable healthcare business? What's your...
So I think a complete doctor is one who has clinical excellence, who also does good teaching and mentoring, who also does research, and who also does public health. So once he is complete, he is not looking for something more. Because everybody, like you said, why he wants to, the plumber's son wants to join in. Every doctor wants to become a doctor because he wants to serve. We really don't know what happens in this 5 years and then remaining 3 years or 2 years of teaching, that he becomes a very wild, trying to earn as much as possible. So we have to definitely look at that, and that change has to happen. My personal feeling is, if there is a selfless work, there are endorphins which gets released, there are dopamines which gets released, there are serotonin which gets released, and people will be happy if you do selfless. I'll give you an example. Like, there is a big central area in our hospital which is called as Aarti Court, and there is a 6:30 morning and 6:30 evening bhajans which happens, and the patient and the attendants can participate. It's a large area. We have on the back side, we have seed balls. So every employee has to give their 10 to 15 minutes. They just mix the sand, cow dung, and a seed and prepare balls, which is just thrown for tree plantations. There are 3,500 construction workers, and there are kids. And for last 6 years, we run a school for them. Every employee has to go and take class for them. We have adopted close to 15 villages, and we have our camps are happening. Every employee also has to select a disadvantaged girl who could be brought in for a GDA and a housekeeping and a training, and we give free of cost training. Once you participate in this selfless work, you start feeling good and you start feeling connected. And that is, I think, the critical thing, because as our founder says, that love is the most deficient thing right now. And there is an unconditional love. There is this compassion which needs to come in. And that is how the change will happen. If we start making change, change is not going to happen. Change is going to happen when we adopt and we also follow those practices, and people see, and then people also start following that.
Sunil, you wanted to say something, that's right.
Yeah, no, so, there are lots of these models of success, and even in corporate hospitals, the point that Dr. Sanjeev was making, but it wasn't sort of, on the path that he mentioned. And we were just chatting right before the session, and we've invested in some of those hospitals and examples that, you first of all, as an entrepreneur, you have to have that long-term vision. If somebody is thinking of, creating returns in 3-5 years in a sector like healthcare, then you will shortchange yourself or the model in some or the other areas. If it's a long-term 10, 15, 20-year vision, then you can set the right elements to succeed. We had invested in one hospital called AIG in Hyderabad. It's known for gastric sciences. Phenomenal success, very clear. The doctors are not paid as high as what, in other hospitals are paid. It has the highest volume possible. It still provides, endoscopy at possibly 50% of the average market price. And it's still the best gastric sciences hospital in entire Asia. It still generates a mind-boggling EBITDA. I can't disclose it. But, it's because of sheer volume at a price point which is 60-70%. Best clinical practice across the region. Mayo, it is the only hospital that has a tie-up with Mayo. Second hospital in Asia besides one in Philippines, which is tied up with Mayo. So it is possible. I think the starting point is the vision and the length of vision. It has to be a long-term vision, long-term journey. You have to follow it with all the elements, which is doctors, staff, patient, all of it. The best doctors are in hospitals like AIMS, Safdarjung, where they are not paid as high as in private sector. And the best of clinical care is given in those hospitals, and the richest of the patients will go to those hospitals. So there is a reason why, right? Because the point that he was making is that not all doctors will work for money. But then how do you create an ecosystem where, those kind of doctors can thrive, where they don't have the pressure of bringing patient. The hospital will bring the patient. You just focus on clinical care and you focus on research.
Wonderful. So what you're saying, I just want to summarize, is issues really don't, the issues that are magnified in the media are not really with the corporate hospitals that are visible. They are a lot with the unorganized sector. What you're also saying is a little counterintuitive on the investment strategy, that don't look at a short-term investment strategy, look at 11, you actually said 11 to 20 years, and I was wondering which investor is going to hold out like that. What you're saying, Doc, is, something that I'm struggling with personally. I keep telling my children, you can come first in class, you can make a lot of money, you can do whatever, but if you are not giving back, it's all kind of meaningless. And I'm right now struggling with the reverse. My older one earns 2 years, and I'm not saying this to be vain, but 2 years into, she's a clinical psychologist. Her 30 to 40% of her money goes into charity. Right now, also as we talk, she's taken the car and taken a rescue dog to this. So, but I think they've experienced the joy of giving. I think medical practitioners have to get that feeling of making that difference. Thank you. I'm sorry, there's a time's up. Fortunately, the bomb's not gone off like in the movie Speed. But thank you for being a patient audience. I'm afraid we don't have time for questions, but I'm sure y'all will be around. Okay, to address questions later. A big round of applause for the gentleman.